the rest of the people to come.
Presentation, or are you just speaking?
I have a small
Okay, have you got a...
They should give us.
Yeah.
Many people there, but I don't know.
I don't know who's doing what.
It should work.
Окей.
It says the presentations are there.
Окей. Доброго дня.
Good morning, dear colleagues. I'm very happy that you have selected this session to listen about the communication component. And, well, since even though there are not so many of us here, I hope we will get the answers to the questions that appear in the course of preparing to communication. We will get feedback from you for us to understand what the needs are, your needs as the main players in the public health markets. I would like to introduce my colleagues who, together with me, will be leading this section. This is Dr. João Breda, head of the Department for Prevention and Control of NCDs, and Mr. Rovana Merit, WHO consultant. My name is Władysław Zbanacki. I'm Deputy Director General of the Center for Public Health. We will start with one small presentation, which I would like to present the communication strategy we have developed with our partners from the civil sector, and tell you about where you can get the materials which could be used when getting prepared for effective communications. So, with your permission, let us start the presentation. So, you have a very cozy atmosphere, so I'll be seated. So, with regard to communication strategy, actually this is the first document that was developed as a part of the plan and the Sustainable Development Concept, which envisages the block related to the development of the communication strategy for priority issues of public health. And non-communicable diseases became the first component which has been implemented in the course of preparation of this big systematic document, which has to be approved by the Cabinet of Ministers resolution. This communication strategy is corresponded to the national NCD plan. It is open for improvements. We will speak about this, why it is open for improvements and adjustments, and what we are planning to add. It can be used at both national and regional, local levels in terms of messages, definitions of target audiences and mechanisms. Here you can see those who participated in the development of the strategy. Ministry of Health, Center for Public Health, World Health Organization, and Advocacy Center Life. Well, actually, a year ago, in Copenhagen office, we worked on the third edition of this strategy, and now you'll be able to see it after it has been improved. Actually, I'm very grateful both to European WHO office in European region. Unfortunately, Bent is not present here. They took very active part and spent a lot of time organizing meetings with the experts who provided overviews, updates of the situation and helped us a lot. Of course, World Health Organization, we're very much grateful for this. With regard to the international practice, why do we take communication as one of the main elements of the influence on NCDs? These communications are identified as important items in terms of NCD control in such global documents as the Global Action Plan for the Prevention and Control of NCDs for 2013-2020, Action Plan for the Prevention and Control of NCDs in the WHO European region 2016-2025, Shanghai Declaration on Promoting Health in the 2030 Agenda for Sustainable Development, and Ottawa Charter for Health Promotion. Yesterday we saw several presentations which had best buys proposed by the WHO as an effective tool in terms of expenditure on prevention. And communication was identified as one of the most efficient influence tools. Yesterday on one of the slides you could see that the main types of NCDs are cardiovascular diseases, chronic respiratory diseases, cancers, type 2 diabetes, and last year mental health was added. In Ukraine the situation is like this. The part which is related to mental health, it is a separate block, and even a separate institution is dealing with this issue, the State Institution for Mental Health. Their concept has already been approved for developing mental health system in Ukraine, and so that is why the first 4 blocks were our responsibility. As a part of the communication strategy, we have identified a number of objectives related to 6 components, and they are relevant to every and each risk factor for NCDs, and they include raising public awareness of risk factors of NCDs and healthy lifestyles, debunking the myths about NCD prevention, increasing the level of citizens' participation in information and awareness-raising campaigns, and to enhance the community's role in promoting health prevention and control of NCDs, strengthen commercial advertising of alcohol, tobacco and unhealthy foods, which contribute to the development of NCDs, to encourage the recognition of NCD prevention and the promotion of healthy lifestyle as priority objectives, and promote effective cooperation for their implementation at the national and regional levels, as well as improving collaboration with media partners and mass media in order to raise awareness of NCD prevention. To say that this has not been done before would be not right. It was, but it was done in a quite fragmented way. I remember 2 years ago when I started working, I was working on the last component within one of the projects implemented by USAID. I was traveling throughout the regions, participated in the trainings for journalists, explaining why it is useful and interesting to write about public health and how to do it understandable and interesting for readers and for decision makers, political decision makers at the local level. The World Health Organization, starting last year, proposes the 5-to-5 approach to NCD prevention, so we should affect 5 risk factors: tobacco use, alcohol, unhealthy diet, insufficient physical activity, and another component which is a little bit out of the context, it was added last year, this is air pollution. We, in this communication strategy, actually we were focused on behavioral risk factors. We selected 4 risk factors, major risk factors, which can be modified by means of behavior change. This is the countering tobacco use, alcohol use, countering unhealthy nutrition, and lack of physical activity. For each of these blocks, the target audiences were identified as well as key messages. Maybe I wouldn't speak much about these elements because I think everybody in their folders have the printouts of this nice booklet which includes the communication strategy. You can look through it and identify for yourselves the target audiences you can influence and you are interested in influencing to get the effect, as well as key messages. And now a few words about resources for preparation of communication activities. The last year we had the request from the regions and mass media saying that they can't get on time the relevant information which they can use to prepare their messages. Such practice of mass media, they need information very quickly, within a few hours, maximum within a few days, and we are not always able to meet their requirements. We decided so we need to help and simplify this work somehow, and starting last year we have developed the mechanism or tool, I don't know how to call it, structuring it. We have covered all infectious and non-communicable diseases, split it into the blocks which include infographics, information materials.
Інформаційні матеріали і до них є вільний доступ, ви можете їх звідти скачати, вони абсолютно мають собі свіжі дані, релевантну інформацію з перевірених джерел, evidence-based, і можна використовувати для того, аби комунікувати для використання вашим журналістам, якщо у вас є якісь такі запити. Один із таких посилань знаходиться зараз на нашому сайті, тут є посилання на наш Facebook-портал, і з нього можна перейти на сайт, в сайті є матеріали, розділ матеріали з пропозицією. Де його презентації я перейду на наступну сторіночку. Вона відображає зараз сторінки Міністерства охорони здоров'я та сайт Міністерства охорони здоров'я. Як на Фейсбук-сторінці, так і на сайті дуже часто оновлюється інформація про звичайні питання, які стосуються медичного обладнання, і використати ці блоки з сайту і з Фейсбуку можна спокійно вільному доступі на сайт. На сайті є окремий розділ і навіть по алфавіту можна вибрати тему, яка вас цікавить. Перейдемо на наступний. Наступний це сайт SDC. Центру контролю та превенцію захворювань Також тут це вже трошки складніше використовувати володіння англійською мовою, насправді зараз Google Translate переносить можна скористатися цілий сайт. Тобто є такі розділи, які стосуються health. Там можна вибрати ті матеріали, які вас цікавлять. Розділ безпеки харчування, розділ, який стосується споживання тютюну, вакцинації та імунізації, здоров'я. Наступний сайт – це теж один із сайтів, які адмініструються CDC. Він називається healthfinder.gov. На ньому теж безліч матеріалів, які можна
There's a huge amount of materials on this website that can be used to prepare communication strategies related to health promotion. It's a very good site and we will like it. The next website also from the same type American sites, healthypeople.gov.
Ось тут дуже красиво food and nutrition, фізична активність,
The sections about food and nutrition, physical activity, health literacy.
І ось я точно не пройшов цей слайд, це слайд, який я
Important
для себе
website,
написав.
which actually was the first site I discovered for myself. This is the World Health Organization website, and there are a few sections that can be used. The first one
Ось є посилання на нього, це Newsroom.
The first one
Є також
is related to
який
news.
стосується медіа.
Newsroom.
Нам можна буде
Another
завантажити
section
безліч
is
матеріалів,
about
інфографік,
media.
які
So there you can download
абсолютно всі
enormous amount of materials, infographics, all the issues related to public health, starting with immunization, mental health.
Це є ще обсерваторія
Also, this is the health where you can get information, statistics with regard to every country in the world, including Ukraine, and compare it with other countries. Having compared it with other countries, you can see the current situation in Ukraine, look at the plans that were implemented in other countries, look at their statistics, see what was efficient and what was not. One more website, which was really interesting for me, is the website of the organization which studies the global burden of disease. This is the IHME located in the United States, and when using this website you can first of all get the comparison and visualization of the statistics in our country, compare it with the world statistics, and this site also enables us to see how risk factors impact morbidity, mortality, burden of diseases. So this is a very powerful website which has updated and relevant information. Now they have information for 2017. There is a separate web page related to each country, including Ukraine, and the bonus is that almost all web pages are translated into Russian. For those who don't speak English. So actually this was a brief overview of our communication strategy. I hope that the question that you may have will be able to answer them. And the suggestions you will make, we will hear them, and we will involve in the communication strategy your positions, because like I said, it is completely open. And last year, when we received from the World Health Organization the message that the fifth factor, risk factor for NCDs is air pollution, now we're thinking that one component, one block has to be included, dedicated to air pollution. And when it is complete, then we will have the complete document which can be included in the overall communication strategy. Thank you for listening. We will conquer NCDs together.
А щось ти в мій мікрофону.
Can you hear me? Okay. Is also okay with the interpreters there? You can hear me? Yeah. Good. So, good morning to you all. It's really a pleasure to be here today and discuss a very important issue, which is really communications around NCDs. Communication is very important, and some of my friends that work in communication, they would probably say that communication is everything. You really need to communicate very well if you want to convey a message to your population, but you also need to communicate well if you want to really affect policymakers and the way you would like to influence them in terms of designing, devising, developing and implementing and evaluating new policies as well. So it's very important that we really give communication the importance that they need to have. They are not everything. We really need to do the work on the ground, but we really need to communicate really well in a very target fashion. And particularly in NCDs, because we need to be seen. Nowadays, we're in a world of, really communication. And it's like if what you're doing and if the areas where you are working, if they are not seen, it's like if they don't exist. So if you're not seen, you don't exist. So you really need to make sure that your work is well known and it's properly communicated. And this is a problem for many of us which are health professionals. We were not raised in this world. We were created in a world where we have our patients and we have our work and we serve those who really need us in our clinical work or in our public health work, and we never paid really enough attention on the importance of communicating properly. And therefore, I would like really to congratulate our colleagues from Ukraine and the organizers of the conference for really addressing the topic of communication. And I also have a presentation talking about communication. It's not very long because it's just to touch upon some of the issues that we think they are important in terms of doing the right thing, because sometimes what we don't really do well in health is that we don't communicate properly and we don't communicate with the right people. And sometimes the way we do it is really not appropriate. Sometimes it's too complicated. Sometimes it's boring. Other times, actually most of the times, people don't understand what we are saying. I've seen many of my colleagues on TV giving interviews that 90% of what they say, people don't understand. And if you're a doctor, you have this tendency to go there and just, speak your scientific language, show that you are very clever, but then people don't understand what you're saying. I mean, really, and this is happening all the time. It's not just when you are talking with let's say, your patients or your people you are serving on that moment, but also when you're talking with policymakers. You really need to talk as if they are school children, because this is the level of understanding that most of our policymakers have about health, because you shouldn't expect that they know a lot about health. So we really need to be smart in the way we communicate, and we really need to be very targeted. This is an effort we are doing in WHO Europe, that we communicate properly, right? So my slides are a bit around this topic, how to better communicate, and many of the slides that I'm doing the presentation on behalf of our communications officer. Her name is Tina Kier. She's an excellent communication person, and we work really well together. And what I will tell you is a bit of a history of success, but also some of our failures, because we've had many failures in communication, probably more failures than successes. So basically it's about, discussing barriers to communication, also opportunities, and also giving you some examples. One of the things that I would like really to discuss with you is this requires that we are very strategic and that we plan. So when you're designing a new public health plan, you're thinking about it, right? You're thinking about the different areas where you're going to act. You're thinking about the different actors, the different stakeholders, different players. In communication, you have to do the same. You can't be an amateur. You really need to do it in a nice way, and it needs to be planned. It's very important, because communication is not that simple. Most of the time, we are missing the target. So we really need to have a reflection on this, because many times communication is like, oh, the last thing we are thinking about. So you want to start a new plan. If you want to starting a new plan is convincing stakeholders that this is important, it's all about communication. You have to communicate about the plan. You have to make sure that your stakeholders understand it and they buy into it. You can have the greatest plan, very well written, everything is there, but if you don't sort of sell it properly, forget it. It's not going to happen. People need to be excited about your new ideas. Comes down again to communication. So these things, it's not so simple, and we have to be, I would say, professional. This is why we try, in our office, we always try to get the professionals to work with us. We have the ideas, but we have to get the help of those who know about communication and bring a bit of strategic thinking. We also need to be very focused on what is that we want to achieve, right? What's our objective? Sometimes we think, well, we want to do a plan about something, but we really not focus on the target and what are our objectives and our aims. So we really need to think about what is the aim at the end of the day. This is very important. Another common mistake is that we tend, because we are sort of doctors or health people, we think that just because we say, and because we are right and we are scientists, everybody's going to follow what we're saying. I mean, and we have a specialist of behavior with us. I'm not going to go into our area. It's way more complicated than that. You can tell people everything, theoretically, what's good, what's bad, what's more or less okay, what's not okay, but people will not follow at the end of the day because it's much more complicated than that. It's not about telling people what they have to do, because in most cases, actually, they already know. Fortunately, there's lots of information floating out there. People really know what's good and bad for health in general. It's about how can you affect people's behavior. It's way more complex. And many of the things that affect behavior, sometimes they are related with poverty. It's a bit what this image tries to convey. So if you don't have access, if you don't have a primary care doctor, if you're not registered, or if you don't have enough money to go to the doctor, vaccinate your children. What's the point of communicating on TV? Go there and vaccinate your children if you don't have the money, or if you don't know where to go, or if you're too far, or if you don't have proper housing conditions, you don't have a job. It's even unethical sometimes that we communicate and that we are prescriptive. We are always prescriptive because if we are doctors, we always prescribe a medication, right? That's a problem here in communication. It's not about prescription. It's about, really helping people to decide how they're going to run their lives in an ethical way, because sometimes people cannot change. So you cannot just say, do this or do that, if there are many other factors that are really barriers to be healthier. And therefore, there's many influencers and drivers that when you communicate and when you have a communication plan, you have to, you really need to take that into account. So, it's about also getting to the right audience. Sometimes your message in the bottle doesn't target anyone, It's not like the Treasure Island where the bottle really got to someone. Normally it doesn't, because we're doing the wrong things. So we really need to target the right audience, and we need to know who do we want to target. And depending on that, then you sort of design and devise your communication. So sometimes we are sending message out without any impact because they are not properly targeted. They don't have the right design, and we are really not targeting the right people. And sometimes, as I said before, we're putting it in a way that our messages are really not understandable by those we want to affect. So our messages sometimes are, as I said, too complicated, or they are given to the wrong audience, and so on and so forth. So there is a need to, you need a lot of thought into the strategy of communication. Before you start, you really need to have a good plan. All big companies have really a very important strategic plan about communication when it comes to any change, and we really need to focus on that. Then, just a point on the channels. Fortunately, in a way, unfortunately as well, nowadays we have so many communication channels that sometimes we don't really know where to go. it's really a mess out there. There's many opportunities, but also many challenges and many threats to the way we communicate. And sometimes on the same platforms, there's people that communicate more effectively. Look at the anti-vax, the stupid things they say, but look how much traction they get, right? A lot of attention. Sometimes really crazy messages that you don't believe on that. It's the same about NCDs. I've seen messages about sugar and even about smoking and even about alcohol that they are unbelievable. But still they gain a lot of traction because there's lots of opportunities also for fake news and misinformation in all these new very complex and complicated world of communication that we have nowadays. So we really have to be very smart. Who is our target and how we are going to segment this communication, right? Do I want to communicate more with doctors or researchers? So if that's what I want to do, then there are channels that are more appropriate. But if it's more the public, then I'm going to do that. Although these new channels bring a lot of complexity, they also bring a lot of opportunity because you can really target more your message. Communication is all about segmenting your message to a large extent. So you can do that actually better if you do it professionally. So you need, again, people to help. You need people with knowledge so that you do a bit of everything. On TV, normally you go there, it's like you're spraying everywhere, right? But if you want to communicate more with researchers, you have Twitter, maybe you have LinkedIn, and you have things that can be really more specific. So maybe you need a bit of all of this when you communicate in health. In ministries of health, normally you don't have much people. I can see that in Ukraine, and congratulations for that. You're paying a lot of attention to these communication issues. They are really important, and I really commend you for that. Right? So we really need to have people that know about these topics and that can help us, to be more diverse, more varied, seize the moment. There are great opportunities there. So we can particularly use all this digital world. The digital world is here for the good and the bad. I will talk about marketing from the negative side later on. But there's also the marketing and the communication from the positive side. So we can really communicate much better if we do the right thing here. So now I think maybe some examples I would like to give you. So in summary, there's key questions we need to address. What change do you want to make? Who should receive our message? How will this message interest people? Because, I'm targeted with hundreds of messages every day. Some of them I'm really interested when I look at my Twitter or my Facebook or my LinkedIn or when I see something on TV, not that much anymore actually, but some stuff really, it's interesting for us. So you really need to think about how am I going to capture the interest of my target audience, right? And then can they do something about it? And how are they, what kind of tips can I give them to do something about it, So if a policymaker can really think, childhood obesity is increasing so much in Ukraine. We don't know that, but I suspect, like in many other countries. So if let's say an MP in your parliament is concerned with this, what are the tips that you can convey about stuff that they can do? Because normally, every people is concerned, especially if you're a policymaker, you want to do good, right? And if you want to do good, then sometimes you don't really know how, and there's lots of opportunities here. So, one of our top best-selling, it's the HBSC. It's a study we are conducting since early 90s. We have more than 40 countries, the vast majority in Europe. And it's one of the best-selling products in terms of WHO downloads. It's about, communicating properly about young people. It's about young people's health. It's based on a survey that we conduct every 4 to 5 years, looking at the health status of young people, age 11, 13, and 15-year-old. And the findings are really normally very catchy. not just for journalists, but for a big audience. It's excellent data, so we have data since '92, as I said. The last time we collected data was in 2014. We presented the data already, and we're starting the new study now. But we really reach large audiences. This is just a quote from The Lancet. As you know, it's one of the main scientific journals in the world. And, we really got a lot of traction there. So you really need to try to communicate via the scientific channels, but also the public channels, which are more impactful as well. So here are a few quotes. So on one hand, we managed to get to The Lancet. You should always aim to get your stuff here, maybe on the Ukrainian most important medical journal, or in the New England Journal of Medicine, or the Lancet, or the BMJ, whatever. It's important because if we are scientists, our data should be credible and should go there, but we also need the BBC ones, and the New York Times, and you want the Telegraph as well. I mean, we have really a bunch of histories of success. When you have data that compares countries across Europe, if we put it the right way, and if we use our political master, for example, here you have a few quotes from our regional director, where she really, so we've created press releases and we've used quotes from her that were, as you can see here, on the New York Times and stuff like that. So you really need to be ambitious. Dream about the communication of your stuff. Of course, if you have data for Ukraine, it's difficult to publish it on, let's say, global things, but we have to be fit for purpose. If it's at the national level, you want to be on your main, news outlets. And if you have the right message in a simple way, you can do it. This is what I would like really to convey. How can you do that? Well, you need to really capture attention of the people. You need punchy data. You're not going to invent data, but you're really going to massage, in the good sense, your data in a way that you really use catchy titles. So you need to tell a story. And you need to know how to talk with journalists. I mean, if you're going to tell a big story that they don't understand, forget it. They disconnect soon. So you really need to tell the story the right way. So pitching it is very important. Then you need simple stuff like fact sheets, for example. If you publish a scientific paper, don't expect journalists to read it in The Lancet. They won't. But you can prepare one pager with a summary of everything. I bet that they will love it. We've tested that. So you also need to engage with partners. So one of the things I personally do on my job a lot, I engage, for example, with the European Society for the Prevention of Obesity. We go to their national congress. We do the same with addictions and alcohol. We do this with the cardiovascular, with the European Heart Network, for example. We engage with partners. You also need to engage with your national partners. It's very important, okay? You need to have a social media sort of kit. It's not just randomly putting stuff on Facebook. You need to think about what are going to be my 3 or 4 tweets, what I'm going to put on LinkedIn, on Facebook, different audiences, all of that. And nowadays, for example, last year we had a major conference on breastfeeding. We worked with 30 countries. We work with bloggers. One of them, she has 5 million followers. I mean, it's incredible. If they are honest, and in this case, of course, we check the people because we don't want them to work with us on breastfeeding and promoting formula at the same time, You have to be very smart. You need to choose them well. But if you have like the people, influencers, with where their heart is in the right place, you can do a lot because you can target really big audiences. So influencers, different ways is important. An example of what we've done in Tajikistan, Kyrgyzstan, Kazakhstan, we did a very important study. We would like to do it in Ukraine, by the way, looking at trans fats in foods and salt. We found massive amount of salt. Kazakhstan is the country in the world where probably you have more salt. But in Tajikistan, we found more trans fats, 15 times more trans fats that you can have in a full day in one of these foods. So this is killing people. So we had to alert them. So we designed a communication campaign with, social media, infographics, media engagement, also with photos. The photos, as you can see here, they are very powerful. This is actually not the best one, but we have more. So you can link, people connect with this. You link traditional diet with also all this new information. Diet in Central Asia is healthy in general, used to be. Lots of fruit and vegetables, nuts, but this new stuff is full of bad fats, for example. People have changed the way they cook, especially in street food, local markets. This is increasing heart disease. Also in Ukraine, this is not just in these countries. So, another example on, affecting high blood pressure. How we engage with media. We sometimes use country stories, is very important, to resonate with journalists. Using social media, again, producing fact sheets. We can prepare questions, we can anticipate. So a group of questions that we know that the journalists or people are going to have, and policymakers, and we can already be prepared on what we are going to say. We can suggest what the actions need to be taken, because people can say, okay, I know that 30% of my population has high blood pressure, so what? What can I do? Then you can be ready to say, okay, the best thing you can do, also in Ukraine, you need to control hypertension with medication. But at the same time, more important than that, you need to reduce salt intake. It costs less money, costs no money in most cases, and it has a much bigger impact than even medication. So what are we waiting for? There is an urgency there, and we can do that. And then if people want to do more, you have your background reports, you have your scientific papers. If you are lucky enough to have a journalist who wants to do a really big piece, then you can have your background reports as well. Then effective messaging and using your masters. So your leaders need to convey the right message as well. So this is again one of the codes from our regional director, Susanna Jakob, on salt reduction. So she's really saying salt reduction is the most important thing you have to do to control hypertension. So what are you waiting for, right? If your country has a consumption of 12 grams, the WHO recommendation is 5. So, there's something wrong here, okay? So again, I talked about this, you need to use the relevant platform. So long story short and in a nutshell, we really need to be more effective, and we can be way more effective. So you need to know who you want to reach and what you want them to do, right? Just spraying people with a few things, sometimes it's not enough. Tell a story. That story, if it's compelling, it's very important. You need to target people to the heart. It's about NCDs, right? So touch them on the heart if you can. Use different angles with the media. Use fact sheets and simple data to summarize your data. You're not a bad scientist if you're saying simple things. If you're a good scientist, you have to be able to communicate with policymakers and also the media in simple words. It's not that you're conveying bad messages. Just simplify it, wrap it up. Engage with partners carefully. There's a lot of conflict of interest here. There's vested interest from the food industry, from the pharmaceutical industry. That is unacceptable. And we in WHO, we are called to lead with that at the global level, and you at the national level. You have to work independently, free from conflict of interest. But you also need partners at the same time. Choose them well, okay? And then get your influencers on board. That's very, very important as well. I think I would stop here. I spoke too much. I promise I'll speak less on the second presentation. Thank you.
Дякую. Дякую, Жан.
Thank you, Joao. Yes, it works. Thank you very much. Very interesting presentation. And I have one reflection. One of the most effective communications and entry points of communications. That's what I saw in Copenhagen in WHO office for European region. Sorry for such details. When you enter the toilet and you see in front of you glass with urine, which means that you need to hydrate yourself, and if the color of your urine becomes too intensive, then you are dehydrated. So, and this really works, and you think, okay, maybe I should have a glass of water. So, and this really hits right on the target, and this is very understandable, very good example. Thank you very much. I would like to give the floor to Ms. Rowena Merritt, who will tell us about social marketing approach for behavior change communication.
And I will stand up because I'm hidden behind some waters at the moment. So I will stand over here and hopefully not block it. So hello, yes, I'm Rowena Merritt, and I have a confession to make. Originally, I used to work in commercial marketing, and all those bad products that you don't want people to eat, I sold them. I marketed them, and I was really, really good at my job. And then about 10 years ago, I thought there must be more to the world than getting people. I was working in Japan, getting Japanese people who are normally very healthy to eat hot dogs and burgers. I thought there must be something more. And so I moved over to social marketing. But social marketing uses all those clever tricks that commercial companies use, but instead of getting people bigger and to drink more and smoke more, it does the opposite. So it's the same techniques, it's just for social good. So that's why it works, because commercial companies do it really well. So we can do it really well also. Yesterday, they talked a lot about NCDs, and ultimately, it all comes down to behaviour. The behaviour of the individual. You've got to get people to change their behaviour to reduce the NCDs. Without people changing their behaviour, we will never, ever have the progression and the progress that we need to make. But the trouble with behaviour change is behaviour is dynamic. You may not eat cake one day, and then today you might eat lots and lots of cake. So behaviour is dynamic. And what we do in marketing is we try to get that sustainable behaviour change, in that we try to influence people's habits. Yeah, we've all got these habits. We brush our teeth twice a day without even thinking about it. We drink beer when we eat fish, all these different habits that are in our psyche. And so in marketing, we try to understand that and get behaviour change in relation to those habits. Knowledge, as we've heard just now, is really, really important. And knowledge is the first step. But the trouble is, knowledge is not enough to change behaviour with the majority of the population. It's very important that we know what we should and shouldn't do. If you want people to eat 5 portions of fruit and vegetables a day, they need to know that they should eat it, and what size a portion is. Is it a handful or whatever it might be? But as you can probably guess from my accent, I'm from England. And we're really good. We know what we should do in England. We know what we should eat. We know that we shouldn't drink too much. We know that we shouldn't smoke. And yet in England, if you look at obesity figures, we're really, really bad. Yeah? We eat too much. We drink too much alcohol. And that's why we have big, big obesity problems. Important, but we need to move beyond knowledge. And the reason why is because ultimately we're not rational. We're not rational human beings. We don't make... Okay, better? No. Hello? Translation box? Yeah, good now? So we don't make rational choices. We don't make rational decisions. As we've just heard from our last speaker, we're driven by emotions. We make decisions based on how we're feeling. I don't wake up on a morning and think, how can I have a healthy, balanced, nutritious breakfast? I wake up on a morning and I think, what do I really want to eat for breakfast? Oh, I hope the hotel has those pancakes again. That's what I thought this morning. Because what we eat, if we smoke, if we drink, it's not just because of the food and the alcohol, it's because of the feelings it gives us. It's the emotional attachment that we have. It's that alcohol makes us feel free and sexy and attractive and all those things. And so if we want to change people's behaviour sustainably, we need to understand those emotions and tap into those emotions like commercial marketing companies do. Coca-Cola says open happiness. Who wouldn't want to open happiness? Starbucks coffee says the best coffee for the best you. Who wouldn't want to be the best you? So we've got to understand those emotions and tap into them. We need to find a way to resonate with people and focus on what matters to people now, at this moment. Telling a teenager that you might die of smoking, of lung cancer in 50 years' time has no effect on most 16-year-olds because they're living for the moment. And Pepsi, by chance, advertisers live for the moment. So in social marketing, we say, you know, we might be experts in nutrition, we might be experts in behaviour change, but we're not experts in the target audience's lives. So it's not just about getting a bunch of experts together and communicating messages to the target audience. It's about understanding your target audience, understanding what emotions they feel attached to the behaviours you're trying to change. Like, why does this boy like blue ice cream? What would make him eat a banana instead of, I don't know what flavour, maybe bubblegum flavour ice cream? What's his ambitions in life? What motivates him? Who's he influenced by? All that information is important to understand, well, what is that person's life like? Because we don't eat food in isolation. We don't drink alcohol in isolation. It's impacted on by so many wider factors that we need to understand. And you have to engage with your target audience throughout, because you have to understand things from their perspective. Now, some of you might have seen a duck first. Yeah, who saw a duck first? A few of you saw a duck first. Some of you might have seen a rabbit first. Anyone see a rabbit? I always see a rabbit first, but I liked Peter Rabbit growing up. But the point is that we see the world as we see it, through our eyes, as opposed to understanding it from our target audience's perspective. So that's why when we develop social marketing programs, we engage with our target audience throughout the whole process. Instead of just consulting them once and going away, we keep going back to them to make sure that we are understanding the data correctly, because it's the same data, but we interpret it differently. So what is social marketing? Well, ultimately, social marketing is a process where your consumer, your target audience, is at the center of it. There's a strong evidence base to support it. But for me, it's more a change in mindset. It's thinking, well, what benefits do the target audience get from doing the negative behaviours? What benefits do people get from smoking? What benefits do people get from drinking alcohol? And understanding that and using that to develop an exchange. And ultimately, an exchange is, can you give them something better than they're currently getting? So if I said to you, in this country, why do people drink alcohol? Why do young people drink alcohol? What benefits do young people get from drinking alcohol? What would you say? So peer-to-peer, yeah, peer-to-peer, so... Yeah, being adult, grown up, yeah, definitely. I went for a walk yesterday, and just near this hotel, there was lots of young people drinking. And they were having fun, and they were flirting with each other. And ultimately, we want young people to have fun and flirt with each other and feel part of a group. But we just need them to feel that without alcohol. So that's what we have to understand, the benefits they get from doing the negative behaviour, and then you communicate something even better for them. Or you give them those benefits, but in a different way. And commercial companies are really, really good at communicating these kind of emotional benefits. So I do a lot of work around breastfeeding, and of course my main competition is formula milk. And I look at a lot of the breastfeeding promotional materials that we create. And they give lots of facts and figures about how good breastfeeding is for mother and baby. And they're correct, and it's important that mothers know the facts and figures. But then you have a mother who's tired, she's giving birth, her breasts ache, she's struggling sometimes to feed the baby, or she might have mastitis, she's feeling very emotional, her husband's not helping much, or my husband didn't help much, and you have all these different emotions. And then you have the commercial formula milk adverts, and they say, we know you're a good mother, we know you're trying your best, and our formula milk is developed based on 40 years of breast milk research, not formula milk research, breast milk research. And you're tired, you're at the end of the road, you're at the end of your tether, it's 2 o'clock in the morning, your baby's crying, and you think, well, if it's developed on 40 years of breast milk research, really, is it any different? Am I a bad mum if I stop breastfeeding and I give them formula milk? And the formula milk companies say, no, you're doing your best. You're a good mum. So what are you going to do? So the facts and figures are really important around breastfeeding, but not at 2 a.m. when your breasts hurt and you have a screaming baby. So it's understanding how we can position it and understanding what our competition is doing and how clever they're doing. And then we counter market and we fight them back. And ultimately, in social marketing, we try to make things fun, easy, and popular. If you ask young people to stop smoking and all their friends smoke, that's not fun and easy and popular. You're isolating them. You're saying, stand out from the crowd. And most young people don't want to do that. And by popular, we mean the social norm. If you think it's not the social norm to breastfeed your child, if you think everybody else in your community drinks alcohol whilst they're pregnant, you're not going to stop. You're going to think that's okay. So it's about changing the social norm. And commercial companies do this really, really well. I was in America last month, and I saw adverts for Budweiser. So adverts for Budweiser Light, like the low-calorie beer. And so when they had people in the gym, and then after they'd finished in the gym, they were hanging out with their friends, drinking beer. And then in the next advert, they had someone running a marathon. And they got to the end of the marathon, and they had a Budweiser Light beer. You don't drink beer after you exercise, but you do now. They're changing the social norm. They're doing it very cleverly, and we have to do the same. So what would happen if you told a teenager in Ukraine that smoking was bad for them? What do you think would happen? Do you think they'd know? Not much, yeah. Do you think they know smoking's bad for them? Yeah. When we ask teenagers in England, 100% of them know what smoking is bad for them. They can even tell you why it's bad for them. And yet they still do it. And you say, well, why do you do it? And they say, well, I look cool. And they say, but I'm an adult now. I can decide. I can decide whether I smoke or not. And it was the same in America when they did research with teenagers, and I'm sure it would be the same here in Ukraine. Smoking is like a tool of rebellion. It's saying, I'm an adult now. I'm in control. It's like dyeing your hair or lots of body piercings. Piercing your tongue is very rebellious in England at the moment. So I'm going to show you now an advert from a social marketing campaign that understood this and used this concept of rebellion. And they said to young people, if you want to rebel, we'll give you a chance to rebel. But instead of rebelling against us, your parents, your teachers, your doctors, rebel against the tobacco industry. Because the tobacco industry tried to get you addicted from the ages of 11 and 12. And they leaked all these memos from the tobacco industry that show in England that they used the colour purple in their adverts for one of the big brands, because purple appeals to 11 and 12-year-old boys. They're out to get you, basically. And that's what they got. So they got young people rebelling against the tobacco industry. So I'm going to show you, hopefully, now a video. Is it going to work? Oh, yay. So that was just one of the adverts. They also had adverts of young people going together in groups outside the tobacco companies, throwing eggs at the executives as they left. So that's really rebellious, yeah, throwing eggs, but you're doing it with your friends. So if you think about the fun, easy and popular, that ticks all those boxes. They're making it easy for you to rebel. They're giving you channels to rebel through. They're doing it all grouped together. So lots of fun. You're hanging out with your friends. They did lots of prank calls where they would phone up and ask to speak to Mr. Butt, like butt cheek and stuff like that. And they posted these all over social media, and they became very, very popular. But the important thing is that it prevented thousands of teens from even starting smoking. So often with our strategies, we focus on people stopping smoking. You know, we know when people get to about 30, 35, they often want to quit smoking. And we often focus on that. When this project stopped people from even starting smoking, not by talking about health risks or facts and figures, but just giving them something fun and cool to do instead. The final example I want you to see is in relation to seatbelts and safety, and it's going to be around this intervention mix. So in social marketing, you think about how can you support the behaviour change, can you design the physical environment to help the behaviour change, so create smaller plates and bowls so people don't put so much on it. What information do you give, and how can you control? How can you control, disincentivize, basically, the behaviour change? So to give you an example, it's in relation to car seats. So if you had to guess, which country would you guess this picture is from? If you had to guess a country. Do you think Ukraine? No. England? No. Indonesia, maybe, yeah? Mexico, maybe? It's actually from America. It's from Dallas. And in Dallas, they have a large Hispanic population that come over from Mexico and Central America. The trouble is, the Hispanic population in Dallas don't use car seats for their children. So if you look at the fatalities, the children have very high death rates compared to the other population groups. At first, they told them the dangers of not wearing a car seat. It will kill your baby. Had no effect. Didn't change the people's behaviour. So then they gave away free car seats. Nobody used them. Well, they did. They used them in the house in front of the TV, but they didn't use them in the car. So then they said, maybe we should take a social marketing approach, because we've failed so far. And we will do some research. And this was the emotion. This is what the mothers told the researchers. My child is always safest in my arms, and God decides when to take my baby. So if you believe you have no control in your destiny, if you believe God controls everything, then ultimately you're not going to protect your baby because you feel it's out of your control. So based on that, you can imagine what we did. Very simple. We got a priest, God's messengers on earth, very Catholic religious group, and we got the priest to bless the car seats with holy water. We got to do it at the church service, and then the priest helped put the car seat into the car. And the message we communicated was not about death or fatalities. It was communicating you're doing what's expected in the eyes of the church. And in the same way that a seatbelt wraps around your baby, you fasten it around your baby, we said God is putting his arms around your child. So if you think your baby is safest in your arms, but if baby's going to be even safer in God's arms. So in relation to the intervention mix, we didn't just give them information, but we created a service to support the behaviour change. And we didn't give away the car seats for free, we subsidised the car seats. So they were cheaper, because car seats are expensive, but people don't always value free things. So when we forget social marketing, we create messages that educate people about risks, benefits, laws, etc. But when we add it, we create products and services that help people overcome the barriers and communicate things that people actually care about. And it worked. Within the first 6 months, car seat usage within the Hispanic population went from 21 to 73%. Within a year, it was over 90%. It is now the social norm within that community. So just to finish, my top tips are you've got to be really clear on what behaviour you want to influence. Listen and learn from your target audience. Focus on benefits that your target audience actually care about, whether that's God's putting his arms around your car seat or rebellion. Use this to create promises that your target audience value, and use a mix of interventions to support change. Thank you very much.
Дякую, Ровена. Дуже цікава презентація, і я дуже радий, що Ровена долучалась минулого року саме для розробки однієї з комунікаційних кампаній, яка буде мати старт цього року, дуже скоро, і буде присвячена саме профілактиці споживання алкоголю вагітними жінками. Минулого року ми мали тренінг з соціального маркетингу, і наші фахівці дуже позитивно оцінили ті знання, які нам надала Ровена. Дуже дякую. Ми наразі закінчили з презентаціями, і у нас є декілька...
And we now have a few minutes for questions and answers, so please feel free to pose questions and answers. Ми в два канали працюємо, да? Ага. Well, the presentations were excellent. I am really happy that I've chosen this particular flow. Ravenna, I'm also a marketologist. I have been working in PR for 25 years, and I understand this problem when you work with the doctors and they speak one language and you speak a completely different language. How do you overcome this barrier that you're not a specialist, you're not a doctor, but you're the communication expert? Maybe you could share some tips on communicating with the experts, with the doctors, with the professionals. How did you overcome this mind gap, this gap in between the two of us? Because it is true that we're speaking a different language.
Does this one work? Yeah. Okay, perfect. Yeah, it is very difficult, and often I find medical doctors don't always respect my expertise, if I'm being honest. I find what does help is getting them to personalize it. So I was in Tajikistan just last month, and I was with a load of doctors who were rather overweight themselves. And they kept focusing on, we just need to tell people to lose weight. We just need to tell people to eat healthily. And I said to them, do you really think it works? Like, what did you have for breakfast this morning? I didn't want to shame them, but I wanted them to just take stock and sit back and acknowledge. And actually, one of them said to me, oh yeah, I broke my chair in my office yesterday. Ha 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 ha. So he said, and then he said, actually, it's not enough. He said, I know what I should do, and yet I still overeat and I still smoke. And so we use that then to start the conversation among all of us. Well, how difficult is it to be a doctor when you are overweight yourself, or if you smoke yourself? How do you raise that conversation with your patients, etc.? So we use that as the catalyst. But yeah, it is very difficult because I come from a psychology background, so they think I'm kind of away with the fairies half the time. Yeah.
Дякую. Будь ласка.
Thank you. Thank you very much for your presentation. I've gained quite a few important things, not only as a professional, but as a mother as well. I have the following question. In Ukraine, we are seeing the medical reform. It started at the primary level. And the primary physicians, the administrators, were entrusted by many unusual roles. In particular, the role of the reform communicators. They were to communicate about the changes to their patients, to their staff. And there was a great resistance and with a certain hidden agenda, with some sort of hidden expectations of the doctors themselves. What would be your advice? How can we communicate with the resistance, not unconsciously as the teenagers do, teenagers who want to be part of the community, but with the people who has this hidden agenda, which prevents them from listening to what you can say?
Yeah, do you want to try it? Yeah. I'm just making sure I'm understanding.
It's really difficult because you will know that some of these people that are resistant, they will never change their mind. So we have to understand that there's always losers and winners in a reform, and we have to accept that. Those who feel that they are going to be losers, they will probably oppose. But there are many that do not understand the advantages at the end of the day. And therefore, we have to communicate that in a very transparent way. So transparency, in my opinion, is very important. What the reform will bring as a gain to the population of the country, to those we are serving. And it's very important, you know? And if that comes with a sense of mission that we can convey, improving health of the population, that is really, I think it's important, and it can help. Another thing which is important is clarity of the reforms. So it's very important that people know what's expected from them, and it's very important that those changes are communicated in a very clear way, so that everybody knows what's expected from them, that there are really no big dots. And many times when the reforms are very good, but devil is in the detail, and sometimes you cannot fully implement them because you need people to buy in. The best way is to get people to believe that the reform is good. I myself am from a country where we are very proud that we have one of the best. We are a relatively poor country in the context of the European Union, but we have one of the best health systems in the world. Probably always scores 5, 6. So we're always on the 10 best systems in the world because we invested in primary care, and because many years ago, and because doctors and nurses and all the health professionals at the local level, they may complain, they may feel unhappy some days, but they know that this is the right thing to do because they know what the system means, which is a system that delivers to all people in a democratic way and that tries to deliver, especially for those who need more, those who are less resourced, those who have less money, especially is more worried with the poor. It's not perfect, but it's very important that if people understand what the reform means and if there is transparency, again, you need to communicate about that. And also the population. Some of the reforms that, for example, you have in many countries, the population opposes to it. If you want to sort of aggregate, for example, maternities, doesn't make any sense to have lots of maternities everywhere. All countries know that. But closing maternities in a small city, can get the Minister of Health fired because the population tried to oppose. Having a very small health center that serves, this is a caricature, but that serves 50 people, probably is not the best way. But if you close it as a health manager, that is going to have the opposition from the population and also from your health professionals. So you really need to have a strategy that you communicate in a good way, and that strategy is transparent and that people really buy into it, that they agree with it. And then hope for the best. I personally think that you always get losers and winners, and you will not convince everybody, but if there is transparency and people believe, people understand the benefits, they will, I think that step by step, but you have to be patient as well. I think it's a process. 2 steps ahead, 1 step back, then 3 steps ahead. It takes time. It really takes time. But when the benefits will start showing, when the results will come, people will be convinced easily.
Just to add very quickly to that, I think you're spot on about the transparency, but it comes back to the exchange. Doctors are human beings, and my husband says I'm the most cynical person in the world because I say nobody does anything unless they get some benefit. You volunteer, you get benefit from volunteering, you get the feel-good factor. So in the same way that to get those teenagers to change their behaviour, with doctors, I find that there's an exchange. And sometimes it is about doing what's best for your patients, but sometimes with doctors, the bottom line is money. If they think the change is going to help them profit in different ways, they often make the changes. So in the UK, we have targets that we set for doctors to achieve. They get money attached to those targets. Most doctors in England don't care about chlamydia and certainly don't want to talk about STIs with teenagers. But then you say to them, oh, but there is money attached to this. All of a sudden, they're having the conversations about condoms left, right, and centre. So I think it's about understanding also that with your healthcare professionals, there's got to be an exchange in it. And it might be finance, but it might be for better population, it might be career development, it might be all sorts of things.
Дякую.
Thank you. Excellent presentation, and I'm particularly grateful for practical cases that can be used and implemented right away. I would like to share a case from Ukraine. You've talked about the safety belt. Yesterday, the parliament has failed the law draft, which suggested increasing fines for failure to use the safety belts. The information campaign that forecasted, was it unsuccessful? I would not say so, because many people got involved in the process and they started using the safety belt. But I wanted to ask, you've demonstrated dynamics of improving the situation with the safety belt by involving the opinion leaders, the priest in that particular case. So the fines haven't worked, right? Because we know that in the US there are significant fines for traffic rules violation. And also, I would like to make certain that I understand correctly. You have made a differentiation. The statistics from NCDs and injuries are separate, but when we look at the information campaigns, there is no general example. So how do we deal with trauma? Do we talk about the general system of non-communicable diseases, or is it some sort of separate module which is not included in the NCD as the system? Thank you.
Yeah, I think that, and I will also leave also the issue of the seat belt and the behavior change for your comment as well. I'm sure you will comment on that. I think that there is no silver bullet for all these problems. So you always need a combination of approaches, and a successful policy normally has a bit of everything. So behavior change techniques, using key opinion leaders, but also the enforcement in terms of the law. There's many examples in many countries where increasing fines, I mean, the fine can be very high, but if people don't perceive that they're going to be caught, so if there is no police on the street, then people don't care about using seatbelt because they know they will never be caught. But if you know that if you drink and drive, that the chance of you being caught out of the discotheque after drinking is very high, then you will be more careful. So it's about enforcement. It's also a complicated thing, but in many areas like alcohol consumption, seat belts, and many of these things, the area of legislation and enforcement is important and plays a role. So there needs to be a balance between the changing behavior techniques, using the communication, the mass media campaigns, and all of that, together with the law. And sometimes it's not that the communication sometimes does not really change people's behavior, but convinces people that this is important. Sometimes it only raises awareness. But raising awareness that, for example, drink driving is a problem, then people will accept that we have more testing. People will accept that, drinking and driving is something totally unacceptable and puts people's lives in danger. So these kind of things, normally, they are very complex problems. So we need a combination of different types of interventions. Sometimes in Parliament, it doesn't work one day. But next year, you need to convince more MPs, and next year will pass. I just know of a country where they passed the taxation on sugary drinks, but they didn't pass the taxation on salty foods. Now they're coming back with the salty foods next year. It's also a matter of how you work with policymakers. And many times, and unfortunately, these evil forces, tobacco industry, is sitting in the parliament of all our countries. It's not only in Ukraine. I know, I have a friend of mine. He was a brilliant PhD student working in he was not a medical doctor, but from the health sector. He ended up working for one of the major pharmaceutical companies because he was in the parliament. And they had hunted him. He sold his soul to the enemy, unfortunately. Why? Because tobacco industry, but others, also alcohol and even more food, because food we all eat, food is good and bad. It's a bit more gray. There's no black and white. You have to understand these dynamics and these forces. Of course, having the tobacco industry sitting in the parliament is really bad. I mean, the others we can understand a little bit better. But you have to accept that it exists, and therefore you need a combination of everything. And you have to be patient. In public policy, there comes a moment in, talking about God, all the stars are aligned. If the stars are aligned, you get your legislation through and you succeed. So sometimes don't give up, be patient. In public health, we have to be stubbornly patient. And we have to wait for the right moment when it's there. And in politics, fortunately, if you live in a democratic country, political parties change. They will change. Someday more people, more interested, they will come. So be optimistic. I would be very optimistic because at the end of the day, we're actually improving a lot in public health in Europe. We have many threats, but we are improving a lot.
Дуже дякую.
Thank you very much. We have actually exhausted our time. If you have any more questions, we can continue the discussion during the coffee break. So please, we have coffee break until 11 o'clock, and then we will continue. Thank you. Dear colleagues, hello again. I see that there are more people than we had before. I would like to invite Dr. João Breda, head of the WHO division on NCD prevention and control, and Irina Minailo, the national expert on qualitative studies, and Olga Sinko, who is the director of BEAT Health and Social Impact, and me, Władysław Zbanatsky, from the previous session. So, colleagues, please take your seats. We are starting. So, at the first part of the session, we spoke about the communication strategy on NCD, about effective communications and social marketing approaches to behavior change. At this part of the session, we will be speaking about such things as digital marketing regarding unhealthy products. And I would like to give the floor to Dr. João Breda, please.
Hello, is this working? Looks like it's working. Okay, again, thanks very much for the opportunity. Normally I like to stand up, but I think that here it fits well in terms of the presentation. Otherwise, I'm going to cover the slides and so on. So forgive me for sitting during the presentation. The topic today, because this session is mainly focused on communication, and during the first part of the morning, for those of you who are not here, we were basically addressing the topic from the positive side, meaning how can you use communication to make sure that we basically promote health and prevent non-communicable diseases. And during our session, we discussed ways of potentially using the new social media and the digital world in a positive way. And there are many opportunities there. But there are also many threats. And one of the things that we see today is that the digital world is being used to promote unhealthy behaviors. So a lot of the advertising to children from foods that you see today, to your children, to your nephews, to your grandchildren, is coming from digital platforms. And you don't even imagine. So if I hold on my phone, companies know it's me. If I give it to my children, they will know it's another person. Today, they can know this. And they know exactly who they are targeting. So, and you don't know. So if you use your phone, of course, your mobile phone, your smartphone, you'll be subject to different adverts and promotions compared to your adolescent children, to your young adults at home, and so on and so forth. So the issues in the digital world are very, very serious. And we don't have really many ways yet to deal with it. We are starting. The European Union, for example, we have adopted, a new legislation, pan-European legislation, to deal with these issues of privacy of citizens and so on in the digital world. But it's good, but it's not fully comprehensive. And in many countries in our region, there is a long way to go. So if we're talking about health, we're really talking about, as you heard today, implementing WHO policies to achieve the Sustainable Development Goals. And one of the areas that is really very much discussed today is health in the digital world. There are many opportunities. We can use smartphones and internet access to improve health literacy. We can use it to advise parents and children in terms of health behaviors. There are many positive things that we can do in the digital world. And overall, it's very positive. But as I said before, there are also many negative things. And some of them, they are quite out of our control. And you as parents, you can't do much to avoid it. And many of the times, you don't even know what's going on. I bet that you don't know that when your children are playing their video games on their laptop or on their smartphone or on then yours, even in yours, tablet, they're playing games and they're being subject to advertising of certain products, which probably you cannot imagine, right? And this is very important because advertising really influences behavior. And we know that advertising has an impact, for example, on childhood obesity. But it also has an impact on drinking. So young people, when they drink alcohol, many of the choices they make, they are influenced by alcoholic beverage advertising. And much of these adverts, they come through nowadays, digital platforms, social media and others. And in spite of all the legislation and protection we have against tobacco, marketeers from tobacco companies, they discover a whole new world. This is like pure gold for them. I myself, I've never been a smoker in my life. I'm receiving advertising of electronic cigarettes and tobacco products on my smartphone because I like wilderness and I engage going to the mountains and so on. And through one of the let's say, programs I follow on Instagram, these tobacco guys are now advertising to me. Of course, I ban it, I delete it, I hate it, but I was advertised. I didn't ask for it. So all of us, I'm sure you all feel this every single day. So imagine your adolescent child, your school children, your young adults, and so on and so forth. So this issue of marketing in the digital world is very important. And if we are to achieve this, the new WHO strategy, the transformation of WHO, which is going on at the moment, is saying that we have to improve the lives of 1 billion people with more healthier populations. Healthier populations means prevention of NCDs and means less alcohol, no smoking, better diets, and so on. But advertising is really creating problems to a large extent, especially on childhood obesity. So a few years ago, we had a commission at the global level that, in the WHO context, produced a report with recommendations to reduce childhood obesity. We have many countries with problems around childhood obesity. This is very serious. As I presented yesterday during that presentation, I showed you the prevalence, which is very high in most countries, always above 20% in terms of overweight. In Ukraine, we don't know yet, but it would be good to know. So I hope you can join our big study also in the forthcoming years, because I'm sure you're not an exception, probably also an issue here. And so all the recommendations that talk about tackling obesity, they really mention advertising as very important element that needs to be addressed, and that children deserve to be protected from commercial interests. And some of these economy is important, but consumers and consumer health is also very important, probably more important. So we need a balance in our lives and in our societies. So when it comes to the WHO recommendations, one of the areas where all our programs on alcohol, on tobacco, on food and nutrition, they all talk about stronger control of marketing. That marketing really influences people. If marketing wouldn't work, companies would not invest billions of dollars every year just, for fun. They invest in advertising because they know that advertising makes a difference. Whenever a company starts a new campaign on television or online, you see their sales going up all the time. Otherwise, if it doesn't work, they will try a different campaign. So advertising works. So if you talk, for example, with our friends from the food industry, They will say, oh, you know, advertising is not that important. We're just trying to steal customers from our competitors. It's not really like that. Advertising serves to, of course, shift consumers away from one brand to the other, but the most important thing is that advertising tries to get new consumers. Alcohol advertising, for example, they want, you know what they want? They want younger people and especially women. Why? Because men, we drink so much that it's almost impossible to drink more. So, I mean, men are not interesting for companies because men in Ukraine, you already drink so much that even if companies invest all the money, it's almost, the increase in sales would be very small. But because women drink much less, they're better customers. And because young people drink less, because young people drink less than old people. Keep that in mind, because sometimes we, the old guys, we say, oh, it's these young people. No, it's not. In alcohol, for example, we, the old guys, we drink much more. So because the young ones, especially young girls, 11, 12, 13, this is when you start. And when you start, you don't like the taste of alcohol. Do you remember the first time? It tastes awful. Wine? When you're 11 or 13, if you taste it by mistake, it doesn't taste good. You like sweet flavors when you're 11 to 13. This is why, you know what the alcohol companies did? They started something called Alco Pops. You know what's Alco Pops? It's a soft drink with alcohol. It's like orange juice where they put alcohol. It's not that they make a lot of money out of it, but they conquer new consumers. So if they start with girls at 11 and 12 and 13, they will then, when their taste and their appetite for more, let's say, bitter flavors will change later on. When you're like 16, you know, our taste really changes. And then you're ready to move into the other alcoholic beverages. This is what companies do. They want younger consumers, and especially women. And you have to be aware of that, all right? And if you're aware, you can decide better. So you need to be aware of advertising, what it means. But we also need to use regulatory approaches. We also need to use legislation to limit marketing. So we need two things: that consumers know what advertising is. So if a child is 7-year-old, he really cannot distinguish if it's a cartoon or advertising. An adolescent should be able to do that. And we can improve the literacy of kids, so in terms of understanding the negative aspects of advertising. But we also need regulation to protect them. We also inscribe that in the alcohol policies. We have European policy on food and nutrition, talks about marketing. An alcohol policy talks about marketing. Tobacco policy, really total ban on advertising of tobacco products is very important. It's all included in the best buys of WHO, meaning that if you take action on advertising, this has a very positive effect. And this effect is cost effective, meaning that you're not just saving lives, but you're saving money as well. All right? This is very important. You have this in your folders. I think we all received the WHO NCD best buys. If you look at it, both for diet, for alcohol and for tobacco, marketing restrictions, they're all best buys. So there's no way, there is no effective policy in a country to affect NCDs without talking about marketing. It's a difficult conversation? Yes. Are they going to complain with the ministers and the government that, you know, these guys from health, they're destroying our businesses? Yes, they will. You're not destroying businesses. You're in the business of saving lives, right? So if you want to save lives, marketing has to be done, I'm sorry to say. This is why WHO is the forefront organization. I have to say, in this, we are the best. Talk about the other UN, all due respect, WHO. We started talking about marketing of foods and other products like alcohol and tobacco way before any others, since 2010, okay? And you see here a series of publications which are relevant. I would like to call your attention particularly for these last two. This is a nutrient profile tool. I will explain what it means. And this is a report we did 2 years ago on digital marketing. So the nutrient profile tool, what it does is it says when a food is unhealthy. So you may say, if you have fruit and vegetables, right? I hope that you all had fruit and at least fruit at breakfast, okay? No one is expecting that we would forbid marketing of fruits. Unfortunately, there's not much. 80% of the marketing everywhere is unhealthy foods. But you need to define unhealthy foods. To define unhealthy foods, normally we look at the amount of sugar, we look at the amount of fat, we look at the amount of salt, and then we say, okay, this food is bad and that food is okay. We call that, it's a science of nutrient profiling. So when you have labeling, the traffic lights, for example, in the UK, or the Nutri-Score in France, these products, they are based on a nutrient profile. And this nutrient profile was developed by my team in the WHO office in Copenhagen a couple of years ago. We were actually the first region of WHO to do that. It's free to use. Countries use it as an inspiration or for adaptation. When we developed, the intention was to use this tool for marketing. And many countries, some countries are already using it. So a long history, and just to justify why it is important to act on that. Marketing is very complex. I'm not going to go into details, but one of the things that we need to take into consideration is two pillars, basically, when it comes to marketing. One thing is exposure. So we need to know if children are being exposed to these marketing exercises, these marketing initiatives. The other one is power. Not all initiatives in terms of marketing have the same effect. Some of them are very compelling, okay? Some of them have a huge impact on children, those who are about emotions and so on. So it's really important that we take that into account when we address marketing. So the WHO recommendations take that into account. But we are really by far not covering everything we need to cover. For example, we don't properly define the age when it comes to foods. Okay, people would say, all right, we cannot advertise foods to children, but for adults we can, right? In principle, that should be okay. So we have to say what is the age. Most countries in Europe, they have the age of 12. It's too early. So we advocate that the restrictions on advertising for foods should cover at least 16, ideally 18. And of course, for alcohol, they should cover totally, at least before the age of 18, okay? We also need to understand if when children are being exposed and being targeted. Because one thing is, nowadays, when we put an advert on your smartphone, companies, they don't know who they are targeting many times. Because the business of advertising on the digital platforms is so complicated that companies, they buy these somewhere online and they say, okay, I want to expose to 10 million children in Europe, but they don't know exactly how to measure that. We are working on this. We are discovering ways to really measure it and to evaluate exposure of children. But it's very important that we develop tools and we, in a way, force the companies to give us that data. We also need to define unhealthy foods, and we need to address all forms of marketing. An example, the other day I was in a country and they have a new legislation on marketing, but they are only doing it for TV. I mean, it's a waste of time, really, because TV is important, but everything is moving to the digital world. So you really need to look at digital marketing, address classic forms, but also keep your eyes open, especially in the digital world. What we have in food and nutrition marketing in the European region, unfortunately, only 1 in every 10 countries has a clear definition of the marketing techniques covered. Only 7 countries use the nutrient profile, this one here. Only 1/3 of the countries define the age of the children. And, you know, and also 1 in 3 countries only define the foods that are covered. So also in Ukraine, you have a lot of terrain to be covered, a lot of ground to be covered here, and we need to make more progress. This is a study we did in 3 countries recently. If you see, in most of these countries, using the WHO nutrient profiling, more than half of the adverts, they are not acceptable. So most of the advertising on TV is unacceptable to a large extent. And why are the companies focusing on children and adolescents? Well, they have more and more money. So don't give too much money to your children, especially adolescents. Give them the amount they need. The more money they have, the more they spend in junk food and the more they spend on alcohol, okay? The marketeers, they are so happy with the digital world, especially the alcohol ones. This is a publication for marketeers online. I mean, they're really going wild because they say this is a great opportunity. We can communicate in every direction, anytime, with individual consumers. So it's really a wild west in the digital world when it comes to alcoholic beverages. Also on tobacco, novel tobacco products. There's data coming from the US and other countries where, especially electronic cigarettes and other nicotine disposal products, they are being advertised especially to women and to young people. And some people say, oh, they are less harmful. Sorry, it's not true. We don't know. We don't really know. So when they come and say they are less harmful, be very careful. We have to study still, and even if they are less harmful than classic tobacco products, they are still very bad for health, and they will still kill a lot of people with, lung cancer and cardiovascular diseases. So this is a total comeback from the tobacco industry. They are not dead. We thought they were dead. They are not. They're coming back with these products. So please keep your eyes open. You know where they want to invest? Eastern Europe, largest market in Europe. It's not the UK or Spain. It's your country and countries like yours where the tobacco industry is investing, where sometimes regulation is still a bit, under development and so on. So be careful. Influencers, social media, bloggers, tobacco is coming back. It's very complex, the digital world, and therefore we need more regulation. To develop the regulation that controls all of this, we need to know. We organized a meeting last year with people that worked in Google and all these big platforms to understand how this works. I have to say I was completely puzzled, okay? But we have to be very pragmatic because people in government, they have no clue how these things work. So WHO is facilitating their life. So we're finding ways to keep an eye on what's going on in the digital world in terms of marketing. I could also talk about, for example, baby foods. I could talk about breast milk substitutes. They are being advertised online to mothers. I've seen promotions through the digital platforms for for formula, which are completely illegal. They go against the WHO code in many countries. So you have to keep an eye. So digital is good in a way, but there are downturns. So, we need to seize the moment, take the opportunity to use the benefits of the digital world, but we need to be very careful and also pay attention particularly to the downsides. Not just about bullying, not just about violence, all of that we know it's a big problem in the digital world, but also keep an eye on the digital marketing of unhealthy products, okay? So I think I would stop here, and I'm ready to any questions. Thank you.
Дякую, Жало, за таку дуже
Thank you very much, João, for such an important presentation. You have opened up space for thinking. What we really see in our country, especially what has to do to promotion of new electronic tobacco heating products. We have some problems with our MPs, which has recently failed to vote for the law draft that would regulate this market, especially the advertisement market. And this is an opportunity for us to focus, to bring our knowledge together, to communicate more effectively with those who take the decisions or influence the decision-making process. If you have any questions to Dr. Zhao, please feel free to pose them now. If you do not have any questions, let's postpone that to the discussion. If no, I would like to give a floor to Ms. Irina Minailo, who is going to talk about the status on alcohol consumption in Ukraine. Microphone. Let's wait for my presentation to be uploaded, but in order not to waste time, here what you're going to see is the presentation of research. I am going to describe the research on the first slides. But prior to talking, your program's agenda says that I am the national expert in qualitative studies. I do not know how you understand that, but I would like to explain you how it should be how you should understood that. I'm a sociologist. I've been working with the marketing studies and 10 years of experience in more social studies, voting and so on. Qualitative studies are quantitative studies. It's when we talk to our participants of the studies, when we are trying to understand them. I hope it is clear now. So now I would like to use this device. So you can see both Ukrainian and English language speaking. We tried to understand our participants. We studied alcohol consumption and everything that is linked to alcohol consumption. We covered a total of 3 regions, focus groups and paired interviews, family and individual in-depth interview. You can see a total number of participants. The goal of the research was to provide in-depth understanding of current behavior, understanding attitudes, and perception in relation to drinking alcohol. And Ravina developed the methodology of the study, and she helped us work on the materials. And this presentation is the product of Ravina as the researcher and me as a person who was involved in field studies. We also had a number of colleagues who assisted us, and I am honored with the possibility to present the results of our work. The formative research and pre-testing half a year took place in between these 2 stages. So on stage 1 we talked to them, and on the second stage we presented them with the possible messages that could be used in the campaigns. The strategy that Mr. Zbanatsky presented in the beginning of the session you could see at this page. So you can see that when he mentioned the qualitative study, he mentioned these particular studies. So, what was the sample? binge drinkers. Those are people who drink more than 4 alcohol drinks. This is a very complicated system, but the point is that a big number of alcohol consumers who consume too much alcohol in one evening. And if they survive, they believe it's okay and say they continue doing the same thing. But later we will talk about their perception of harm as well. Pregnant women. In our study, we have selected both women consuming alcohol and people who and how much did they consider to drink. And we've also have people, pregnant women do not drink. We wanted to study difference in motivation of these two subgroups. Also, drivers. The drivers who have experience of driving drunk. Regular drinkers, this is a different group of people. That means that people do not use that much alcohol in an evening, but they do that on a regular system. So our assessment, the criteria, the eligibility criteria, and we believed was that the person used up to 16 standard portions of alcohol. The standard portion is 50 grams of vodka, 6 to 18 per week. This is quite a lot, and we were talking about regular consumption. The hypothesis was that people who work hard are more up to this type of consumption. That is why we've had additional eligibility criteria, in particular heavy physical work. So key findings. Alcohol relaxes you. It helps you escape day-to-day difficulties, and this is the easiest way to achieve the desired condition. When we talk about segmentation, what kind of subgroups we see, there is a group for which this is more important. And it is important for the further communication campaigns further is as follows. If you make your key message for this group particularly, then it will be more understandable, and then there will be more chance to influence the behavior. So we would be able to inform people more effectively. And then people will begin thinking more about this problem. The next point is that alcohol makes it possible for people to communicate, to reduce discomfort that arises in the group of people, make it possible to open up, feel better in the social environment. Alcohol helps people talk to each other, find joint problems. That makes it possible for people to understand each other better. They need to understand that they have something in common for that purpose. Perception of risk. Yes, the consumers know that alcohol is harmful, and they don't care. In our study, all people were informed, but they did not really care about that fact. And there is a certain threshold, protection, that makes it possible for me not perceive this problem as my personal problem. If I do not identify myself as an alcoholic, then I have nothing to worry about. And an alcoholic is a person that has certain social consequences as a result of drinking. These are people who are rejected by their families with antisocial behavior. It is not possible to cooperate with these people. So our consumers perceive the alcoholics as people outside of their communication circle. And it is important to understand that this perception is something that makes it possible to people not to identify themselves with the excessive drinking. It also signifies that there is an illusion of control over the situation. I can control that. Everything is fine with me. I am not dependent. I can make a choice whether I want to drink or not. In pregnant women, there is an understanding that alcohol is harmful, but there is some information that is provided by experts or respected people, let's put it this way, priests, for instance, church wine, or doctors sometimes, even though it might be sad to hear that, but nevertheless. And other people who are respected, the mother, the husband's mother, other people women listen to, especially in such a delicate period of their life, and the different recommendations. So there is no clear understanding that alcohol is harmful both to the pregnant woman and the child. Similarly, there is a rather unclear understanding of what is safe or not. Beer and wine might be perceived by people as okay. Very often people can people can explain what are the conditions that make it okay to drink certain alcohol.
And also, if having a small drink is not considered to be drinking. For example, I want to have a beer with dry fish. I want it because I'm pregnant. It means that I can. We know about this stereotype that a pregnant woman may have some wishes. With regard to drink driving, I'm not afraid to die, but I'm afraid to injure or kill somebody. Briefly, this is the main message, the main motive which can prevent from drink driving. With regard to what makes people drink, we discovered that these are the social aspects that facilitate this. It is accepted in the circle of friends to use alcohol because it helps to talk, to chat, to relax, and this is a certain social norm. For instance, I haven't seen my friend for 3 years. Some special occasions, like holidays, maybe some special events people want to celebrate. Also, this is a social norm to use alcohol during celebrations in our society. And you remember the example about beer and dry fish. Then we come to segmentation model. When we're speaking about consumers segmentation, we mean different groups of people. And it's not only demographics which defines people, why they are similar to each other, but also age, profession, level of education, place of residence, big city or small town. But also it depends on people's attitude to certain areas of life and the life principles, values, what they're striving to in their lives. They're also different by behaviours. And as a rule, this is an integrated thing. When understanding people's motivation and values and attitudes, we can understand that one message will not influence this person, but another message can. If we look at this person from different sides. In the category pregnant women, we selected two segments. The first is careful pregnant women. They realize that alcohol is harmful for child's health, and they're trying to control alcohol use, and they think that they make efforts to avoid alcohol in their lifestyles. But they have the following attitude: if I drink a little bit of alcohol, it is not harmful. I don't allow myself to abuse alcohol. That is why it means I'm not drinking, maybe a little bit. Then wish to use alcohol with certain foods. And also they don't consider their current practices as risky, so no perception of risk. And they think that some doses of alcohol are quite safe. The next segment, which we defined in this category, is confused risk lovers, which means these are the women who do not have clear idea of harmfulness of alcohol due to the previous confusing information from the trusted people. We can't call them that are firmly confirmed that alcohol is harmful, like the previous group. They want another confirmation that alcohol is harmful. Show us statistics, how it impacts pregnant women. What if I drink only a glass of wine per week? Did you have any studies on that? Because I heard, I didn't know that a glass of wine can harm a child. They also say, when I don't drink, I stop being part of a company. I like companies. I'm pregnant, I'm at home, I'm alone, I want to see my friends. And my husband drinks too. If he didn't drink, maybe it would be easier for me to refrain from drinking. And also, it's not about me using alcohol during pregnancy. The next segment is people who are suffering from excessive drinking at the parties. As we know, the binge drinking is when people want to drink a lot at one go. And people do this to increase their self-confidence, as far as we understood. They want to be funny, they want to be cool, they are taken as an attribute of a party, and they feel when they drink that they become jollier, they crack jokes, everybody likes them and they like themselves. Then, in this segment, there are those who can be called social workers. They feel pressure from the part of their peers, of their friends. And they feel that if there was no social norm of having alcohol during the parties, their willpower would be sufficient to abstain from alcohol. But they feel that drinking alcohol in a company makes them a part of the company. They don't want to be different. And another segment in this category is partygoers, people who struggle boredom of life. Their day-to-day life may be not bright, but alcohol provides them with some bright experiences, makes their lives more interesting, improves their communication, and they're trying to mark their positive experience, and they want to make their lives more diverse with the help of alcohol. They say sometimes, we drink in a civilized, in a cultural way. We are not drunkards. We control ourselves. In this segment, which we called excessive alcohol users, this category was quite homogeneous. It seemed to us to be quite homogeneous, and you can see the main characteristics. These are the people who are in the circumstances where alcohol makes it easier to accept their routine lives, to forget about problems and have rest. And quite often they feel that alcohol is a problem in their lives, and they're trying to do something about it. They made attempts to quit drinking, but then some event happened, something happened, and they resumed drinking. This is quite a homogeneous segment in our opinion. And we tried possible messages for that. And with regard to testing, I could show you different options, but we don't have enough time for this. And I want to present you the findings of the study. In this category, the problem of alcohol in pregnant women, the most motivating factor for possible refusal or control over the alcohol was the fact that alcohol can cause brain damage of a child. For this message, the most of pregnant women who were tested, they responded to that and said that this is the most convincing argument. This message also makes people seek medical assistance for more, or not apply to a health professional for more detailed and clearer information. This was created by women who we spoke to about drinking during pregnancy. If I care on my child, if I want to be the best mother, then I want for my child a good life. And you can see the family, happy relations, successful life, possibility for having holidays, maybe some hobbies, and this makes me listen to health professionals and avoid the harm which is related to alcohol. The problem issues is binge drinking. The clearest and the most understandable message was the message about stages of being drunk. You're cool, you're funny, you're loud, you're stupid, you're disgusting. Which means the more I drink, the less attractive I become. In the youngest group, this was not taken as positive as in the older one. Some of them said, well, this is funny anyway. That is why we understand that this message will be more valid for older group. And this is what shows the stages of alcohol intoxication. In the same category, the message was, it's not alcohol, it's the way you drink. This is the message that you're always responsible for your drinking. And this message brings back to the consumers the control and responsibility. And it appeared to be the most convincing. If you control your alcohol consumption, then you, so to speak, are successful and you have happy relationships. If you don't, then you lose, and in the end, you become alone. When we speak about regular alcohol abuse, the most attractive or emotional message was that alcohol can ruin more than your health, and but also other aspects of life, like a family, work, etc. They all can be destroyed by alcohol. And the participants also responded to the message, never give up quitting, never give up giving up. It's worth reminding them that this is possible, that these efforts make sense. And you can see the photos that you can lose your friends, your love, and your family, and so on. Drink driving category. Natalia knew her killer, it was her father. He had a few drinks and took her from her friend's home. This message really influenced the older participants, and they spoke about feeling of emptiness if drink driving becomes the reason for their child's death. Another emotionally important message is that I can prevent from drink driving of my friend, respectively. Also, the participants said that there is such a practice to appoint a sober driver. This is both for older group and for younger group. It was clear that they understand this. We don't want to live with a feel of guilt. And the summary is the following: for each problematic categories, the strongest messages are given on this slide, and which should be used in future awareness-raising campaigns aimed at decreasing alcohol abuse. Thank you, Irina, for such informative presentation. I think after this, each of us will think whether he uses alcohol or not. Maybe he has to do something with that. I would like to give a floor to Natalia Olbesinko, who will tell us about 5 effective ways of communication with regard to developing communication campaigns. Good afternoon, dear colleagues. I'm really happy to be with you today. I'm from communication area, and Dr. Joao meant this harmful marketing, negative marketing, which is not for good of people. I'd like to speak more about positive marketing, marketing for health. And I would like to share 2 cases. One case is about 5 rules for effective communications for pregnant women, for them not to drink during pregnancy, because the studies made by Irina and the World Health Organization, they became the basis for our communication strategy. And the project will start on the 11th of June. I'm not going to tell you all the secrets, but I'm very interested in hearing your opinion on the outline of this project. We are in the active process of the launch of the project's launch regarding harm reduction in terms of alcohol consumption by pregnant women. And I would like to also to share the cases related to diabetes mellitus. Maybe it'll be inspiring, and I hope this might be interesting for you to learn what we have done. Be it health is like a one word. I've been working in the sphere of communication for a long time. This is our mission, and our mission to call for healthy societies through hope, through communication, through meaningful projects to make the country and the society better and healthier. We are not fighting with anybody. We are working through cooperation and implement the projects, among which there was a project we helped the NGO Life to implement their project, which unfortunately failed in the parliament, but we hope that still in the future it will be resubmitted and approved. Because it's really a horrible story with the electronic cigarettes with IQOS. But now I'll tell you about 5 rules. Maybe it will be helpful. Very important thing, when I moved from commercial communications to social communications, the first rule is